We will start this in 5, 4, 3, 2, 1. Hey, this is Joe Miyake with the Operation Long Game podcast, and I'm talking with Dale Yuzuki on Zoom. Dale is the author of a new coronavirus book. And then I'm forgetting the exact title of the book. So, Dale, could you please say what it is?
It's called COVID-19 From Chaos to Cure. And the subtitle is The Biology Behind the Fight Against the Novel Coronavirus.
Cool. And then obviously we're going to jump into it kind of more detailed, but what's the basic elevator pitch of the book?
Right, sure. I already see the end of this pandemic, and it's going to be through three major fronts of a war, frankly. It's diagnostics, it's therapeutics, and it's vaccines. And the timing, right, on the vaccine side, you saw the news. Everybody's seen the news about Pfizer's 90% effectiveness.
Yeah.
Seen the news. The same day, on Monday, the FDA issued an EUA, an emergency use authorization for an Eli Lilly antibody. This is for therapy, okay? So another weapon in the fight against the novel coronavirus, right?
Okay.
If we can just lower the death rate, right?
Yeah.
Yes, people will still get infected, but it's not going to be nearly as harmful, right? The concern in terms of deaths.
And in terms of lowering that death rate, is it the vaccine that's going to be most helpful? Is it therapeutics? Obviously there's, it's complicated and there's plenty of things, but when you look at the data and things, what do you see is going to be the biggest contributing factor in that goal?
Yep. There was a research paper that came out in the American Medical Association journal, JAMA, just a couple weeks ago, showing that from the beginning in March through May, the hospitalization death rate was about 27%, okay? 27% of the individuals admitted to the hospital died. And we're talking about three hospitals in the New York City area. They were not overwhelmed, at least from all the work that I could tell, they were not overwhelmed, right? With in terms of overcapacity, right?
Yeah.
You remember at that time, we had the Ship Mercy, we had, Javits Center. I mean, they were all waiting for overflow that never happened, right?
Right.
Well, the death rate through August and September, the hospitalization death rate went down to 7.6%.
Okay.
You're going, oh my gosh, that's a third, meaning it went down by 2/3.
Right.
Now, the explanation, you might say, well, what happened? But you see, the very fact that there's been such great communication between physicians, there's been a number of simple practices. You remember all the sort of concern about not enough ventilators. Well, it turned out that your chances of surviving once you put on a ventilator was only 12%. 88% of the people who were put on ventilators pass away.
Really?
Now, ventilators are typically used for something called ARDS, which is like a respiratory syndrome where people basically, right, their oxygen saturation gets really low. They're going to die unless they get put on a breathing machine, right? The survival rate in that case is about 20%. So you can say with SARS coronavirus 2, okay, your survival rate's not that much better. So, but nonetheless, I think one of the take homes was, okay, we need to do, physicians have learned to not to put people on ventilators so quickly, right?
Interesting.
To do other things such as what's called high flow cannulas in terms of like a lot of oxygen, right?
Okay.
And even use these BiPAP machines for sleep apnea to help get, right, people breathing more.
Yeah.
Use prone position, just flipping people on their stomach, okay?
Interesting.
Would help them. And of course, they've got a lot of clinical trials going on to do sort of randomized testing to be able to show some of the effectiveness of these techniques. But those are sort of like the current practices within the hospital environment. Okay, so that's one piece, is inside the hospital environment, certain practices like that.
Okay.
Then we have medications, right? And Trump right, ended up getting infected. Yeah. They
Yeah.
gave him remdesivir early, and there's evidence that it works very well early. And they also gave him a clinical trial, right, monoclonal antibody from Regeneron, that
Okay.
also in massive doses. You know, when they said they gave him 8 grams, I thought it was a typo. I really did.
Because that's like, what is that for? How much bigger is that in terms of a dosage size than what you would expect?
I was expecting maybe in the milligrams, the low digit milligrams, you know, maybe 10 milligrams, maybe 50 milligrams.
Wow.
Understand, a gram is about the weight of a dime. So
Yeah.
imagine 80 cents worth of protein. I mean,
Yeah.
that's injected. It's just, I was just agog, right?
Really? Yeah.
Like, oh
Very
my God.
surprised.
Yeah. But nonetheless, right, it was able to take, you know, the replication of the virus and just knock it out. Now, you know, this, I haven't been able to dig into the recent EUA. You know, there's just been a flood of news just in the last 2 days. But, you know, so remdesivir was one, right? You've got, you know, these other clinical, you know, medications that are ongoing. And then there are even other medications that you may not have know about that I actually addressed in the book and actually came out in the news. Pepsid, okay, is
Really?
I can't remember the generic name. Pepsid is the trade name.
Okay.
But it is, again, another medication, right? It's safe to take and extremely effective, okay? So, you know, these kinds of advances in treatment is another piece, right? In terms of there are medications and different things that are being used that also lower the death rate.
Okay.
Now, a third thing is interesting, right? We're in a time of social distancing and mask wearing,
Right.
right?
Yeah.
Does it help? Absolutely. I mean, there's a scientist on Twitter, he put together a Swiss cheese model, right?
Okay.
Masks aren't perfect. They will let some virus through. But then you add that with social distancing, that helps a lot too. You limit crowded spaces that are indoors in terms of dining or meetings or what have you. That's
Right.
another, you know, help.
Yeah.
So you can say that really people are getting lower dosages. By that I mean when somebody gets infected, it might be even though they're wearing a mask.
Right.
And it may have been, you know, they tried to practice social distancing, right? But they caught it somewhere, right?
Yeah. Yeah. Just somewhere out of the blue.
Right. But what that inoculum actually could have been less just due to the practices that we're doing today.
Okay.
So,
And then I'm curious, in your kind of in your studying, what was some of the, have you seen any kind of data on the effectiveness of masks in terms of the output, in terms of, you know, like the moisture coming from me or protection? Like what kind of data have you seen from that?
there's some fascinating things. We can go on and on about that.
Okay.
For example, there has been work done. There's a subpopulation of individuals, about 20% of individuals, that either speak in a certain way, have the mechanics of their larynx set up in a certain way, where they aerosolize a lot.
Like a lot of moisture comes out of their mouth?
Not only moisture droplets, but tiny little aerosols. Okay. Droplets only go a certain distance, which is why, right, 6 feet, right?
Oh, okay. Yeah.
Off the ground.
Okay.
But aerosols, think of it as a fog, right?
That
think
just
of
stays
it as
in the
somebody,
air.
Say, passing gas, right? I mean, that's a bad analogy, but it's like the smell lingers, right?
Yeah.
Those are aerosols, right?
Interesting. Okay.
And this one study, and again, very little work has been done, but there's some really interesting research that, you know, out of, you know, a sample, I think it was 40 people, 5 of them were super aerosol people. And I was like, what is it about these aerosol people? So that was, you know, one thing in that I don't know if I'm one out of the 8 people, right, that aerosols a lot, the 20%, or 1 out of 5, whatever the, you know, the sort of small but significant percentage.
Yeah. And you said 5 out of 40.
It was 5 out of 40.
Okay.
But then when you talk about something like, well, Dale, what about just the principle of a mask? It's got to help, right? Because you have a stream, right, of
Right. If you have
aerosols
some
and
kind of,
droplets, you have something to help disperse that. It's got to help. I mean, it's just logical, right?
yeah. And I'm
And
curious then, like you're saying then, I mean, it helps both on the intake of air and not just the output, or is it more of an output thing or both?
yeah, that's a tricky one, right? Depending on the fabric and a number of things.
Yeah.
Maybe you can put it this way. I mean, the Czech Republic had a nice slogan at the beginning of the pandemic, right? You know, you protect me and I protect you. And this idea of I'm wearing a mask for your benefit,
Right.
I'm wearing a mask just to interrupt my own, right, dispersion. That was the emphasis, right? Not so much protecting you on the inside, but protecting you from the source. Now, one of the nasty things about this virus, right, is that the peak infectivity is before you get symptoms.
Yeah. And
Your
what kind
peak,
of, I mean, that's
and
kind of
so
the rub of it. I mean,
the rub of
is
it, it's like I can get sick in 2 days from now, right? And
right.
I'm infectious right now, infecting everybody I'm talking to.
Right. But you look healthy and you look
I
fine.
look healthy. I feel fine. I should be fine, right? I can't tell the future, and that's one of the nastiest things about this, right? Is that that I cannot tell the future, and this sort of 1 week after exposure, it takes about a week, but of where that virus really goes up. That's pre-symptomatic. The
Interesting.
other thing, you may
Okay.
have heard of R0, the R naught, this idea of this is the replicative factor. This is a number by which the virus is replicating. And if it's R naught is greater than 2, we have exponential growth. If it's less than 2, it's slowly dying, right? Because
Okay.
it's no longer this logarithmic exponential growth.
Yeah.
That assumes that we have sort of equal dispersion, where you have one person infecting 2 people and they infect 2 people.
Okay.
It's not like that. You're familiar with Pareto.
The Pareto, like
Pareto
20%,
principle,
80%. Yeah.
the
Like,
80-20 rule.
yeah.
Believe it or not, this virus, the coronavirus, acts in an 80-20 fashion. That 80% of the people who are infected is only by 20% of the individuals. Now, it's not exactly that, okay?
Right. But it's kind of that.
One contact tracing study published about a month ago. This was in India, where they traced, I think it was 170,000 cases. It was the largest contact tracing ever. 60% of the infections were caused by 15% of the individuals. Now think about that. The vast majority of people who got infected didn't pass it on to anybody.
Okay.
And
then, and I guess you're thinking it might be because of that, like unique aerosol, like it might be the unique aspects of the individual that then makes it easier for that type of person to transmit certain diseases from how they talk or how they speak.
Exactly.
That is really weird.
It is really
very
weird.
interesting. Yeah.
And the problem now is we don't have a diagnostic to find out who those super spreaders are. There's still mystery people.
Well, that's really too bad for those people too, because it's like, they were just born with these weird biological circumstances.
Well, it's ironic, right, that one of the super spreading events early on was a Biogen business conference. So this is a pharmaceutical company in Cambridge and Boston area, Massachusetts.
Yeah.
It was a commercial meeting. It was probably, I think it was maybe 200, 250 people there. That one event is responsible for 3% of all cases in the United States.
When was that?
It was like in February.
Really?
Yes, it was
Man.
early on. And it was before that fateful March 11th day, right? When everything, the world just came down, right? Everybody got sick, and the Utah Jazz game was interrupted and all that, right?
Yeah.
But it was that Biogen meeting that was a super spreading event. Now, who was it? They studied, and this is where the genetic analysis comes in handy. So even though the virus mutates very slowly, right? You're able to trace through the mutations that the virus picks up through time, the origins of a particular substrain, right?
Interesting.
So that's how they're able to say, okay, we had this event. Right. Now we're able to trace where it went.
Where that event went through that substrate.
And then do, some epidemiology and some calculations. And so that analysis was done about a month ago, and it was fascinating. It's like, oh my gosh, those are huge numbers, right?
Interesting.
Now, so the emphasis, right, is not so much then, okay, we know what we're looking for, the super spreading individuals. We don't know exactly how to measure that. And perhaps the diagnostic effort, even this idea of surveillance, being able to just give everybody a test, wouldn't that be great, right? Just give everybody a test.
Well, yeah, I'm not a fan of but I know exactly what you mean in terms of the data. Obviously, the data would be great, but yeah, I know what you mean.
Yeah, there's a whole bunch of issues with it, not the least of which is we don't have the luxury of time to conduct the kind of studies you need to understand the weaknesses of a given test that can be produced on the scale of hundreds of millions, right?
Right.
So, at present, I would say that we've made some really great strides. I say on the diagnostic side, I say we, in terms of an industry, and as far as where we are, one of the things I monitor, right, is daily infection rate as well as the daily death rate, understanding that this is the best data we have. And yet, in the back of my mind, I'm thinking, wow, in the United States, there isn't any political, and one of the interesting things about the book I wrote, right, was would I be able to avoid politics? And, other people are much better qualified than I am to talk about the political, aspects of it.
Yeah.
My expertise was around sort of the biology. I understand the biology around how diagnostics work and how they're regulated, and how the FDA has been extremely flexible and aggressive in getting tests out there and approved and scaling. I mean, we're doing on the order, I think the last number I saw was over 1 million tests a day. So, there's a lot of testing going on. And I think that even though the cases are going up, from a therapeutics and a vaccines point of view, there's a lot of really great work being done. And the death, that spike in deaths has not been consistent with the rise in cases, right? Because you see the headlines and it's fear mongering, but it is a concern, right?
Yeah,
there is record number of cases.
Well, and that's another thing that I'm curious to hear from you is where do you think the fear is misplaced, or it is fear mongering, right? But it's not actually that. And where do you think the fear is accurately reflecting the situation?
Sure. I would say that in many ways, the fear on the emphasis of cases, right, is a little bit overdone, because
in terms of numbers of cases reported.
Yeah, numbers of cases is alarming, right?
Right.
What would be more alarming is an overwhelmed medical system, right? That is the fear, is that when you have a rise in cases, you have a rise of moderate or severe COVID disease, right?
Yeah.
And then you have overwhelmed hospitals, and you have a lot more people dying than should die, right? When I say should, you know what I mean? A lot
in terms of should statistically, obviously,
death, right? Preventable death. Maybe I'll put it that way.
Yeah.
And I think and so that is a concern, right? Now, and then I think the other piece is that message regarding cases should be with the reinforcement of the basic measures that people need to take. And what are those basic measures? Avoid prolonged indoor group meetings, right? The Japanese have like a 3 C's kind of slogan, right?
What is that slogan?
I was just looking at it before, and it's like already I forgot it. It's like avoiding crowded places and avoiding. Yeah, see, now I can't remember. You put me on the spot.
Okay, but it's
it's
around kind of like reducing the probability of spreading something. That's the
right. A lot of it is an enclosed space with poor ventilation.
Okay.
But I bring up several different cases in the book where some really good work was done in Korea and in China early on, as far as contact tracing, looking at the ventilation flow of a restaurant, for example, and actually following up on the individuals who got sick, where they were sitting at each table, which direction the ventilation was going in.
Yeah.
And they followed up on everybody, and then who didn't get sick and where they were sitting. Another one was a Korean call center. And the bottom line, as far as these illustrations go, is that it's relatively hard to get infected. By that I mean, so for example, somebody in quarantine in a household,
Right.
the primary people at risk are other members of the household, and the transmission rate within a household is about 12%.
Really?
That's pretty low when you think about it, right?
Yeah.
And there, you might say, oh yeah, are people taking all these precautions? Yes, they take as much as their living situation can allow.
Right.
But it is, when we talk about this, Pareto principle and this, 15% responsible for 60% of the cases, right?
Yeah.
For the majority of people who get sick, they don't transmit it to others, right?
Interesting. Okay, yeah, and it's only that certain percentage of people, for whatever reason, that is more likely to transmit it.
Yeah, and from a public health or messaging point of view, when we talk about fear mongering, right?
Right.
I mean, people are tired. Everybody's tired, right? Everybody wants to go to some sort of normalcy. And then it just becomes a matter of treat people like adults, and let's talk about realistic risk. Does that make sense? What is the realistic risk?
Yeah. One, I think you brought up a good point too of treating people like adults, and that, we just can't. It would seem impractical if we all had to live by whatever, a set of 20 rules all the time, and as soon as you break one of those 20 rules, then we're all trying, we all want to have freedom in our life.
Yeah.
But at the same time, this is obviously a fairly big thing. So
I guess that balance, right? That balance and that discussion needs to take place.
Yeah.
Right? It needs to be debated, and people need to talk like adults. I mean, I was part of an effort early on called One Day Sooner. It's the number onedaysooner.org.
One Day
It
Sooner.
collected tens of thousands of signatories around the world for people to volunteer for challenge trials. What is this?
Yeah.
This is purposely infecting individuals to test the power of the vaccine. Okay. And the thinking there, the sooner we know something's effective, the better. I only participated in one conference call, and it was so predictable.
What happened?
The ethicists, they go around and around and around saying, okay, there's no treatment, right?
Okay.
There is no cure.
Okay.
Therefore, there's a non-zero risk that somebody's going to get infected on purpose and die. And we just, can't allow that.
Interesting.
And logically, you just say, this makes complete and utter sense. And if I die, if I know that risk going in, and I'm the one whose number is up and I die because of it, it's for a decent cause, for crying out loud, because the amount of harms due to, right, kids not being in school is a big one, right? And, these non-essential workers that, I mean, you think about all the industries that have completely shut down, right? the entertainers, right? The
Oh,
restaurant servers, right? The small business owners. I mean, the harms are just multiplied. And so, and what's positive though, in that the UK is ahead of the US, in that they have on their planning, right? They're still working through the ethical considerations and the final approval, but they have a proposal now in January to start challenge trials with relatively young volunteers. We're talking about people in like the 18 to 25, I think, range is what they want.
And then when did you say they were gonna do those tests?
In January.
In January. Okay.
Now, the first experiment they're going to do is finding out what the minimum infectious dose is. Do you
realize right,
you still don't know what the minimum is for you to get sick?
Yeah, so then we don't know what to protect ourselves against, because
exactly. We have ways to measure how much live virus people have, right?
Right.
And I mean, they're cumbersome methods to find that out. It's not the same as a diagnostic test. You need special techniques and special equipment and special reagents in order to do a live virus test. But nonetheless, right, it's a really important thing to measure in terms of how much do I need to get sick. Right now, we have animal models, ferrets, and you probably heard about the mink situation in Europe.
Right? I didn't hear about that.
Oh, okay. Well, they're going to destroy millions of minks that were raised for their fur because they've got the same coronavirus as humans do, and the fear is that they're going to be this big vector, right?
Yeah.
Meaning, channel to infect other people. And ferrets also get coronavirus, and so we understand a bit about how what the dosages are among ferrets. But there's a kind of a big difference between a ferret and a human. You can't just assume. So those are some of the first experiments, and it'll be really exciting for me as a scientist, right, to see how that all plays out. And when I think of getting back to this, treating people like adults, and then seeing what kinds of things that society can do, right?
Okay,
and one of the sad things in our society now, right, is voices cannot be heard. They're censored. And, we're seeing this politically, but we're also seeing this scientifically.
Okay.
And so, for example, when hydroxychloroquine, right, was debated and it was rolled around and there was a controversy around it.
Right.
And physicians, would say, there's a long history of this anti-malarial drug, and I choose to give to my patients, and that's completely within the purview of medical science, right? It's an art and a science, and basically doctors are able to prescribe things off-label, right?
Okay.
They personalize the medicine. If they think that this particular medication, due to their training and their intuition, they can give you something that's approved for one thing and give it to you for something that's a little different, right?
Yeah.
That's their judgment. Well, for hydroxychloroquine, people that suffer from lupus have to take hydroxychloroquine as a part of their ongoing treatment.
Interesting.
And it's cheap. It's like $1 a dose, right? Hydroxychloroquine.
Okay.
And it's been around for a long time. It's a derivative of chloroquine, which is an anti-malarial drug. So it's really, really well known. And the physicians were saying, for the first time in my professional career, I was told how to practice medicine. And you're going,
in terms of like, hey, you're not allowed to prescribe.
You're not allowed.
Even though before it was always, hey, you're the expert, the patient.
Exactly.
You're going to be able to decide whether or not you should be.
Yeah.
Man, and do you think, would you have to guess there's a politicization behind that?
Well, absolutely.
Okay.
Absolutely. And even, not that I'm a conspiracy person, yet you can easily imagine, right? Gilead stock went through the roof with that early news about remdesivir, okay? There's huge jackpots, and their executives are cashing out or whatever. And then remdesivir turns out to be not very effective, right? And so the stock crashes. When I say not very effective, they're still looking at it from the point of view of its effectiveness when applied early. what they're finding out is that, right, it only shortened the hospital stay. It really didn't reduce death in the severe cases. And that's really where you want it. So the work is ongoing. For hydroxychloroquine, the data is also very, very similar in that one of the things that was kind of interesting was the amount of dosages, where a lot of the clinical trials that they were being applied, either the dosages were like really, really high, right?
Okay.
Or it was without, with or without, zinc and a common antibiotic called azithromycin. At any rate, those clinical trials are still going on. Hydroxychloroquine also is not, I think, going to be very effective. I think it's accepted now that even though there was like all this hope and hype and politicization
around the hydroxychloroquine thing,
right, it still kind of ended up, maybe not so effective. But there are other antivirals. There's one produced by Fujifilm in Japan.
And then just out of curiosity, how did a film company? Because I also saw like Kodak being involved, and so I'm just curious how Fujifilm and Kodak are at all.
Yeah. Well, Fujifilm, after the collapse of the film business, right, went into pharmaceuticals and also went into life science supply. So a friend of mine works for Fujifilm, and he's selling like bioreactors to pharmaceutical companies, specialized, production equipment. Okay. Jeez. So yeah, there's a diversity there. I mean, who was it? Ajinomoto is a seasonings company in Japan. Okay. They make MSG. That's what they're known for. I mean, I grew up on the stuff. And Ajinomoto has a very sophisticated, right, drug discovery operation, where they've gone into pharmaceuticals as well. So
how weird.
Yeah. But you're talking about businesses that have to adapt to the times, right? And they can reinvent themselves. It's happened. But getting back to, the topic of, the long game. I remember a couple of years ago talking to a friend of mine about the pandemic of 1918.
Okay.
And the question was, well, it didn't really leave a lasting cultural mark here in the United States.
Yeah.
And it was really interesting thinking about it. But then you put it in the context of World War I, and then you put it in the context of a lot of suffering that happened. You had protests against mask wearing, right?
Okay.
I mean, you had the second peak worse than the first, and a lot of interesting things about that. And then you think, and they didn't have nearly the ability, right, for diagnostics. They didn't have any kind of therapeutics.
Yeah.
And, there were no vaccines, right? And you just say, people have suffered through epidemics and pandemics for a long time. It's just so interesting, to look back a little bit and say, what was it like during the Black Plague, where you got a third of the population that's just gone? What is that like? You can't imagine that kind of suffering, right? Yeah. However, at the same time today, I'm sensitive to, right? I've got 3 children who are not in school, right, due to the pandemic.
Okay.
2 of them, right, are in middle school, and they're doing remote classes.
Classes, yeah.
And I think statistically, 25% of children in the United States cannot, due to technology or their home environment or their connectivity, because they live in a rural area, they can't access online learning.
Gotcha.
It's a showstopper. I mean, it's a non-starter for them. It's like 56 million school-age children in the United States, and you have a full 25% of them that can't access this.
Yeah.
It's not good.
And
right?
even just to now shift it a little bit, how has this affected your home life in the last months? Just how has COVID affected, school, or even just,
how do I say, I live in a nice neighborhood in a big house, and I'm fine.
Okay. Yeah.
I mean, you know what I mean? I'm
like
used
pretty
to working
much
from home, and other than having kids underfoot, there really hasn't been, a big
Anything crazy.
impact. Right. I mean, it's like with anybody, how do I say, who has means, right? That's not, without my own personal situation, it's not a problem. What I am thinking of, right, are parents who are not working from home, where working from home is not an option, right? For the person that, I can think of so many instances where people cannot work from home. I mean, they have to actually be out there and doing their work.
Yeah. The warehouse
what do you
industry,
do?
the service industry.
Yeah.
Yeah.
What do you do with kids at home?
Yeah.
Or, right, they've lost their job and, right, they're looking for other kinds of work. These are the kinds of things that I think about. And more than just think about, it's like, how can I, I'm just one person, what kind of change could I affect? But and that's hard. I remember at the beginning of the pandemic, there were so many people that were so motivated and wanting to do something more.
Yeah,
right?
for the community or for people.
Yeah. So I got involved in a couple of efforts, right? One was Masks Now. It was a pro-masking organization to organize sewists, people who were seamstresses,
Oh,
to
right.
make
Sewing
homemade masks and
masks.
make it available, right?
Yeah.
Not as a substitute for medical grade, but again, to reduce the spread, right?
Yeah.
And then there are a couple of other projects that were being discussed, and it was kind of fun with my scientist friends, as far as how we could put extra effort into volunteer kinds of organizations. But it's interesting, these many months later, how has that turned out? And say the mask effort really was a worthwhile one. Another one was on contact tracing, developing a contact tracing app, right?
Okay.
Much like what the recent Apple updates done in terms of being able to alert you to who you may have been in touch with, right? As far as contacting you. But those kinds of things never got off the ground because the testing infrastructure and the contact tracing infrastructure just really was just inadequate, right?
Yeah. And I'm curious, what do you think is the middle ground or areas of middle ground between constrictions put on society versus the keeping your freedom part of it? Where do you think, obviously it's a very complicated question, bunch of different people, different scenarios, stuff like that. But I guess, is there any scenarios where you've seen a good middle ground achieved, or do you think we're screwed and it's going to be tough no matter what?
Yeah, I think it's the latter, where it's going to be tough. However, Pfizer, right?
Yeah.
3 weeks ago said that they'd be ready with 30 million doses by the end of this year. Okay.
Yeah.
The fact they've got this exciting data yesterday, they also said yesterday they're going to be able to produce 50 million doses by the end of this year. Now, you might say, well, but we have a lot of first responders, hospital workers, that kind of thing. Yeah, that number is about 20 million.
Yeah.
Right? And then if you add, I think, another 30 million who are the most vulnerable, right? The elderly in particular, right? Or people with high risk factors.
Yeah.
And you say, well, but if obesity is a risk factor, Dale, the number goes up to 100 million. It's like, okay, fair enough, right? But that's Pfizer before the end of this year. And then Moderna has already said that they have doses for 20 million before the end of this year, okay? And so these are the two leading candidates, right? We're expecting the Moderna data to come out pretty soon, very likely before the end of this month.
Okay.
Logistically, I mean, I was reading about Pfizer's logistics effort that's outside of Operation Warp Speed, why they chose to go their own way to figure out how to dispense, frankly, a very difficult product. So the Pfizer product has to be stored on dry ice, minus 80.
Yeah.
You can't buy a minus 80 refrigerator at your local Best Buy. I mean,
right. It's just
a frost-free freezer, it doesn't even get down to 0 degrees Celsius. We're talking minus 80. Okay.
Yeah, that's nuts.
In the scientific realm, a non-frost-free freezer, okay, are still sold. These are minus 20s. They build up ice, right?
Yeah.
Because when you have a frost-free one, it cycles up and it warms up and it ruins your reagents. Well, anyway, Pfizer has developed its own packaging, 16 by 16 by 22 inches, okay, that can hold 5,000 doses at minus 80 for 10 days.
Oh, wow. No way.
Think about that.
Yeah,
so
no, that sounds,
they can ship it, right? And they've chartered 20 jets, 20 for daily flights around the country, right? To distribute, I mean, a lot. I mean, 16 by 16 by 22 is not that big.
Yeah, yeah.
On a cargo jet, right?
I know. Yeah, I know. When I'm just thinking of how much money Pfizer can just, is going to be just selling in terms of the packaging. I mean, if they're even helping selling the packaging, it's like, oh my gosh, their entire business.
Well, thankfully, the other vaccines don't need, I think the Moderna one needs a minus 20. And that's easily enough handled. The Pfizer one was the difficult one because of this minus 80 requirement. The Novavax one is regular refrigeration. So the ones that are coming down the line, the logistics are going to be difficult, but nonetheless, right? The logistics are being worked on.
Yeah.
And I'm trying to remember the name of the report. Was it from factory? Yeah, from the from the factory to the front lines. It was in September that Operation Warp Speed basically had a 15 or 18 page plan on what their logistics operations were. And it was called From Factory to the Front Lines, right?
Gotcha.
And that stuff is hard to produce. It's got to be injection grade. Think about all that goes into something injection grade. Borosilicate glass is a certain type of glass that they use for injectables. There's only a few sources for borosilicate glass. How do you get billions of vials of borosilicate glass? I don't want to think about that.
Yeah,
but it's in the works, right? Now you might say, well, then I can't foresee a lockdown type of thing in the United States. I can't foresee, even this sort of second spike in cases. Dale, could you see the deaths going up? Right. Yes, but we have about 40 different therapies undergoing phase 3 clinical trials. No, I think the number is about 30. A lot.
Yeah.
A lot of different therapies. A lot of them are completely new because they're specific against the coronavirus, right? We talk about monoclonal antibodies. They're very specific to sop up, the virus so that the body can sort of intervene. On the genomic side, an enormous, we'll be studying this for a long, long time.
This is going to be studied, I imagine, just for hundreds of years.
But the acute problem, right, is good training for the next one.
Very much so.
One of the reasons that we were so unprepared was that a lot of the plans were around the flu. The expectation was we'd have a flu pandemic. The expectation that it would not be this clustering super spreader asymptomatic thing, right?
Oh, right. Like the expectation was that you'd be able to see who was sick, and then you just ask the people that were sick to, hey, please don't go anywhere. But instead, it's this kind of mystery.
Really mystery, wild, difficult thing to get your arms around. And you look at what Germany and the Czech Republic and France and the UK, they all had masks. And it makes you think, they were practicing social distancing. What happened, right? Why a second wave? And, they're imposing lockdowns. And I talked with an acquaintance in Paris, right? She's been living there for 15 years. And it was just last week. It was like, it's kind of scary in terms of the limitations that they have, right? As far as the number of cases, and you have to say, yeah, it is a nasty bug, right?
Yeah.
And the government response is different. You can say, well, the European approach, it's one way to do it. I know that politically in the U.S., it's just not going to pass muster, right?
Yeah. In
Public
terms
health
of
officials, understand that it's going to be really hard to convince the political leaders that, yeah, we're going to go ahead and just, lock down.
Yeah. What do you think? You were mentioning still like having reason for optimism, and I guess
Yeah.
what are your what's your reasoning behind optimism, and what's kind of the timeline of that optimism?
Yeah, it's what we're living through right now. Approval of new therapeutics.
Okay.
And advances with the vaccines, plural.
And then what is defined as a therapeutic? Like, what is that? I guess, yeah, that's my question.
So it could be, for example, this Japanese antiviral from Fujifilm, right? There's a clinical trial going on with that.
Okay.
The Regeneron, the monoclonal antibody cocktail that President Trump was treated with, is in phase 3 clinical trials, right?
Okay.
And that's one of about, I think there's maybe 12 or 15 different monoclonals. No, I'm sorry. There's a lot more. I think the number is like 80 or 90 different monoclonals. I mean, Regeneron themselves, they isolated 150 different patients' T cells.
Interesting.
To test, right? To make monoclonal antibodies and screen for their most potent ones. And then they came up with a combination of two that they decided to move forward with. And then the other approaches, right? So that's what we mean by a therapeutic in terms of a drug or a medication that you can give people with moderate or severe COVID. Now, one of the interesting things about the vaccine is not to prevent infection, even though that's a secondary goal.
Right.
The vaccine is to prevent moderate or severe COVID.
Okay.
There is a difference, right?
Yeah.
Now they're going to see whether or not it's helpful with regard to the infection piece, but that's not their primary goal.
Yeah.
And it was pretty exciting to think, over 90% effective. What that meant was they had 97 individuals in the placebo group with moderate or severe COVID. And
really?
They may have had 1 or 0 in the vaccinated group, right? It's possible that somebody got the vaccine, and it's possible that, that person, 1 out of 100, right, still got infected and had moderate COVID.
Yeah.
The goal of vaccine is to reduce the death, right? And if you can keep people out of the hospital, right?
Yeah, and if it's more of just like a mild cold or something like that.
Exactly.
Yeah.
Exactly. So
and what do you, in terms of that kind of the science around the death and things like that, what I guess what's your level of optimism as it relates to specifically the death metric, or like the improving of that, or I'm curious around if it's just certain types of people that are also more likely to die from this. And then even a third question of mine is even more just around, like, I know we talk about masks a lot, but like I'm almost kind of disappointed in how just purely healthy living principles haven't been as much encouraged, or
excellent point,
stuff like that. And so I'm really curious about kind of the details on that death rate, but then also just details around simply principles of healthier living, diet and exercise, or whatever that may entail.
Sure. Well, to tackle the death piece, it is the vaccine, in addition to people recovering from the virus.
Okay.
You get, what is that level of herd immunity where that super spreader bounces off,
Okay.
right?
Yeah. Right. You're almost like just trying to take away the effects of the super spreader individual,
Exactly.
because as soon as you take away that effect, then it
Yep.
loses a lot of its scariness.
Exactly. It
Okay.
doesn't, it's not gonna, we're not gonna do this, it's gonna do the exact opposite, right?
Right.
And the CDC, due to serological studies, right, they say that there are about 10 times the number of recovered cases as far as people that have had exposure to the virus and have recovered. So
Right.
what does that mean? Well, we've had 10 million cases in the US already. It means there's 100 million people that have had it and recovered or have antibodies
Oh.
against it. It's like, really? Well, maybe that 50 million doses from Pfizer, that could be all we need. Or that
Yeah.
another 20 million from Moderna. You get to a point, right, where there's enough of the recovered plus, right, the vaccine
Yeah.
that
That the
will,
population is just so massive in terms of kind of having some type of herd immunity or something like that.
right. Then the other piece, right, as far as the death goes, right, once you start protecting the most vulnerable with the vaccine, you expect that death rate to go down.
Okay. Yeah.
Why?
Very
They're
much
not
so.
getting severe, moderate COVID, right? The vaccine.
Yeah. Yeah. Okay.
So you see, that's why the news was so positive from Pfizer, was
Yeah.
they were expecting maybe 60 or 70% effectiveness. They weren't expecting 90%. A
Oh,
lot,
gotcha. So they're
a,
even more kind of just
yeah,
happy around. Okay.
right. That all the effort to get a vaccine to people, yes, it's a challenge because you need to get people to come in twice, a couple weeks apart kind of thing for
Yeah.
full effectiveness. But I think that when I think about effectiveness, right, and percentages, if you have something that's 60% effective and only 60% of people are willing to take it, then you say, well, how are we ever going to get there, right?
Oh, right.
But if
Yeah.
you have, 90% effectiveness and 60% of people willing to take it, then you say, hey, that's a much bigger number.
Yeah. And it's
Now,
just easier to
right,
win.
manage from a public health point of view, and the things that we've learned, and the challenges and the struggles, they're real. And I think the challenge, right, is getting people to understand that there are simple precautions to take, and there are things that are just very low risk, right? And
Okay.
also there are things that you can do to help yourself. So for example, right, early on, it was suggested that vitamin D would really help. And sure enough, a flood of studies have come out to show the effectiveness of vitamin D.
Yeah.
And, I'd say, really? Yeah, really.
Yeah.
Vitamin
Which is
D.
nice. I mean,
And, how are you going to get vitamin D? Yes, sunlight. And if you're in a northern climate, right, just supplement. I mean, it's not going to hurt you at all. And
yeah.
then, like you mentioned, in terms of diet and exercise, I mean, it's like, isn't that a given, right?
Right.
Yet, the scary thing, I guess, about the virus is that, yeah, it depending on the person's immune system, it can uncover weaknesses in the immune system. And
Yeah.
these relatively rare cases, right? And thankfully,
Okay.
there are rare, right?
Yeah.
And and the hard part is, right, the lazy journalist will just go ahead and talk about the worst case scenario of somebody being dead in 4 days
Yeah.
without any
Without, you don't,
context. That was like 1 in a million. Or they publicized the reinfected people, right? So there are cases where people got infected twice with two distinct viruses, meaning two viral strains. It was still coronavirus, but they got infected the second time.
yeah.
But the total number out of the how many millions have been infected worldwide, what the number is probably about 40 million now, it's 5. You have 5 individuals who got infected twice.
Oh, no way.
40 million.
Really?
Thanks a lot.
Yeah, completely.
And so,
And I'm curious about that. This is kind of on the fear mongering section, but like,
yeah.
where do you think just news media has kind of not, might just be giving red herrings or
Yeah.
unhelpful information? Or
Yeah, it's been a real problem, right? It's been a real problem. How much of it? Yeah, I guess it's one of those things where, like for example, even with the Pfizer news, right? They confused, the endpoint in terms of what the vaccine was designed to do. They say it prevents infection. It's like, well, no, it's not
no,
preventing infection. So
it's
it's
just,
things like that, right? Where
yeah,
I and that's challenged as far as in many ways you can say that perhaps even with this sort of pandemic fatigue, for people to understand that yeah, the risks are not high if you're outdoors, right? And it makes a lot of, does it make a lot of sense to wear a mask outdoors? It's like, well, no, it doesn't make a lot of sense, right?
interesting.
And this idea of being a bit more enlightened in terms of, right, understanding where the risks are,
Yeah.
right? And is Thanksgiving going to be a real risk within the family? And then a lot of it has to do with this idea of social bubbles and people limiting, right?
Yeah.
How many people they interact with. And if they just limit it to a certain group of, I don't know, 3 or 5 families or entities, right? And just leave it at that. It's like it can actually work quite well. They talk about it as a social bubble.
Yeah.
One interesting concept from a person in Berlin. He was a leading infectious disease specialist at the Charité hospital there. I heard an interview from him a week ago. It was really, really good because he was talking about for Thanksgiving and for holidays for people to consider limiting their activities the week before. Ideally a full week, but at least a couple days before.
Oh, right. So that when you're going to the Thanksgiving dinner, then you're less likely.
To
Gotcha.
be exposed. And I'm like, that is extremely useful bit of information.
Yeah.
Why doesn't a reporter take that up,
Oh, right. In
and
terms
listen with
of,
people and say, hey, public health tip kind of thing, right? Instead
yeah.
of, drooling over whatever numbers and or focusing in on, I think, is it North Dakota is having a real struggle now, right?
Yeah. I
With
think I heard it
cases,
was, yeah.
or South Dakota, yeah, in terms of, hospitals in danger of being overrun or what have you. And say, okay, yeah, there are hot spots where people need to be more aware and take precautions. I fully understand that.
Yeah.
But the US is such a diverse place. It's a terrible place for a pandemic. It's a great place for innovation. It's a great place for creativity. It's a great place for individualism. It's a terrible place
Yeah.
for a pandemic. But
Yeah.
now, right, you look at the numbers in Europe, are spiking up, and right, and whether or not they will be overrun kind of remains to be seen. But they also have the advantage, right, of the increased medical care. It was interesting. I was looking at the French numbers, right, and it looked like the cases and the deaths were tracking quite closely.
Okay.
And then it made me think about how we in the United States classify a death. And you may have heard this, but yeah, it's true. There's only so many reasons for the cause of death in a death certificate.
Right.
And there is, frankly, the hospitals are getting a premium for treating COVID.
Right.
And people that are dying with COVID versus people dying of COVID, it gets pretty mixed up there, right?
Yeah. And
Just
just
how
out of,
we're accounting.
did you, that mix up, it seems like such a impossible mystery to solve in terms of how many actually died of COVID and how many died
Yeah,
with it. Have
yeah.
you have you seen any gold nuggets kind of in hunting through that nuance at all, or is it just kind of
Yeah. Well, when you look at the excess death numbers and some creative analysis around excess deaths,
yeah
yeah, it does suggest that the number that we currently have for fatalities, what's 230,000,
yeah
overshooting it by about a third.
over, so even that number is being overshot? kind of maybe by a third.
right? Due
Yeah.
to different things in the reporting, as well as, when people actually die of it versus with it, that distinction.
Yeah.
And I mean, one of the intriguing things is the deaths from other causes.
Yeah, because I was just about to ask that in terms of um, those other like, do you see any other big cause that's also
Yeah.
right next to the death of COVID in terms of old age or heart disease or
Yeah. Well,
what?
the amount of overdose and suicides, they're up 20-30%.
Okay, so then are you even saying that like you see like even suicides? You're seeing stuff where it's a suicide, but it still says COVID on it.
No, what we're saying is that there's a lot of excess when you just go by excess deaths and
Okay.
try and calculate into what the COVID number is,
Okay. Yeah.
that there's this big chunk of excess deaths that
That are.
imply that the COVID number is fudging upward.
Oh,
You look at
gotcha.
the total excess deaths and they're saying, wow, there's a lot more. Well, think about this, right? Half the number of transplants never took place. What happened to people waiting for a transplant? Well, they died. Too bad.
Okay.
Too bad. You might
Yeah.
say, well, isn't that a necessary procedure? No, transplants are considered actually optional.
Yeah.
It was cut out. Think about all the cancer screenings. I mean, these plummeted, 60, 70%, right?
Okay.
200,000 cases of abuse, child abuse, were
Yeah.
not reported in just 2 months of school closures in the spring.
Really?
And you're
God, that's
calling it.
terrible.
So, yeah, so, we have certain rational scientists that are saying there's a lot of harm being done just from the school and from the other sort of side effects, right, of limiting people's movement. And people were just scared to death, right, of even people undergoing chemotherapy was down like 40%. I mean, it was crazy.
Oh, wow.
People are, I mean, they're dying of cancer, they're going in for chemotherapy treatment, but they don't want to die of COVID.
Right.
So they're at like, and so they're, and so, so all these excess deaths, right,
Yeah.
gets baked into that. And yeah, the person died of cancer, but it's part of the excess deaths of what we're living through, right? So then you say, yeah, we can't get out of this fast enough, and we'll find out what those harms were looking back.
Yeah.
Right now, right, there just isn't the political maturity yet. I think there's enough voices where parents are actually putting their foot down and applying a lot of pressure, right?
In terms of getting schools back open.
Schools back open, right?
Okay.
In particular, and you say, well, yeah, how does that work with testing, and how has that worked with private schools that had some level of opening? And it's a complicated, politically fraught subject.
Yeah.
Nonetheless, I mean, knock on wood, right? We're lucky that coronavirus does not affect the young.
Yeah.
It would be such a different picture, right?
Oh, completely.
Yeah, if we had a lot of dead kids around, I mean, this would be even, I mean, it's bad enough, right?
Yeah. I mean, that'd be really very scary. Just out of curiosity on the kids side, what's do you talk to other parents and like, how many out of 10 parents all want their kids to go back to school? Is it like a 10 out of 10 thing, or is it like what do you think different parents are thinking right now?
Yeah, I think that a lot of parents, like myself, just put a brave face on it. They just do the best they can
It's
because they
whatever.
know that no matter what they say, there is just going to be on deaf ears, right?
Yeah, like it does. You can say anything to the school and they're just going to go, okay, but we're still doing it. So
Exactly.
it's just kind of, you're going to do whatever.
Yeah,
Okay.
exactly. And while I'm like we talked about before, I'm sensitive to the needs of others. it's really hard because there's so little that individuals can do at this point, right?
Yeah.
Other than, making it clear politically that another round of lockdown is just, there's no appetite at all for it.
Yeah, completely.
And, after we're at month 9 now, right?
Yeah.
That, the summer, I was hopeful that the summer the cases would go down, but they didn't.
Right.
I thought that with warmer, drier weather, it would be better, but it wasn't.
Yeah.
And yet, right, another reason for optimism, right? At one point, they were warning, the media was warning us against a twindemic of flu plus coronavirus.
Okay.
But the statistics from Brazil show that due to mask wearing and social distancing, guess what? Influenza went down 96%.
Oh, right. So that
Washing their hands, people are, right?
Yeah, just after people are practicing one thing, it tends to lower the spread of the other thing as well.
Yeah. And so, that is really good news. Now, I think a lot of people are getting their flu shots on top of that, which is also really good. So, there's going to be some really good things happening.
Okay.
And that's, with, in particular, right, the vaccine news is really, really exciting. And I can say that the end is near.
Okay. And now I'm just kind of curious from a personal perspective, like what, obviously the book's coming out November 12th, right?
Yeah, it had to slip for a couple of days. I'm having trouble getting it formatted as an ebook, but as a matter of fact, this afternoon, the ebook is in its last stages of development. So,
okay. Well, just out of curiosity, I was using Microsoft Word to format my entire ebook. Are you? Is that what you're using, or are you using like a book software?
Actually, I'm using a professional.
Oh, cool. Okay.
I'm using Microsoft Word. He's having me go through a document in Microsoft Word because I assume Microsoft Word has some XML or other capability?
So at least how I did it is I really just tried to check all the boxes of making my book look really official, have some decent margins on it and stuff like that. But then I was able to just upload that docx file to Kindle.
Oh, and you had Kindle format.
Yeah, and so potentially a ton of e-readers are just able to understand, the Microsoft Word file.
So as a matter of fact, just before our call here, I was looking at the ebook in the Kindle software they have in the different tablet and phone formats. And then, looking, because I needed images, right? Because it's stuff that you just can't describe in words. Scientific data cards, like 15 illustrations. They even threw in a cartoon for fun.
Hey, there we go.
But it was really nice seeing it on the screen, thinking, man, that Kindle version's really nice. However, I'm running on my PC, but it's kind of fun. And then it's been a while since I've read through from beginning to end. And as I'm reading it through this time, it was like, it's pretty well written. I wonder who wrote it. Anyway, so it's fun.
Okay.
And already I'm thinking, right, what I would follow this up with. And so I have some ideas about the genomics business in general.
Yeah.
Or like the so what about genomics? Why is it one of the industries of the future, right? Between artificial intelligence, nanomaterials, and genomics, these are the industries of the future because there's still so much to learn. I mean, this is a huge, huge undertaking that, on the biology side is just so open-ended, right? Like, for example, I mean, CRISPR was discovered and awarded a Nobel Prize just this year, right?
CRISPR, I'm not sure who
CRISPR is a method of genome engineering, technique. And it was a naturally occurring phenomena from bacteria to plants, as a rudimentary immune system.
Interesting.
Protect against viruses and other invaders. Okay.
Yeah, wow.
And scientists discovered this naturally occurring phenomena, and CRISPR is and to spare you the details, it's an amazing tool, another tool in the biotechnology toolbox. And it was so powerful that the Nobel Prize Committee awarded it with a Nobel Prize.
Wow.
Yeah. So
that's pretty nuts.
And as far as tools go, yeah, it's going to be applied. It's already being applied to agriculture. It's already being applied to diagnostics. It's already being applied, to just basic research. A pretty amazing and remarkably versatile tool as far as, scientists just come up with all kinds of ideas again and again in terms of how they can leverage it.
Interesting. Well, here we'll call it good for this conversation, but please once again plug the book, and then also your website, and then just anything else you want to kind of be remembered by.
Sure. Well, I'd say my parting message is calm down, keep calm. This pandemic is almost over. I see the end. And I'd say, as far as, the book is written for the non-expert, and it's about technology and the biology behind diagnostics, therapeutics, and vaccines on the way to a cure for COVID-19.
And then what was the title again?
COVID-19 From Chaos to Cure. The book website is my first and last name, DaleYuzuki.com. And I blog about industry vertical around genomics at yuzuki.org.
Okay, cool. All right, well, sounds good, Dale. Thank you very much, and I'm glad we could have this conversation.
Yeah, nice meeting you, Joe.
All right, you too. Bye.